Commission de la santé mentale du Canada, Mental Health Commission of Canada.
My name is Anne Duryea, and I am the Roots of Hope Community Coordinator for Meadow Lake and area in Saskatchewan, and I work for the Saskatchewan Health Authority. The Meadow Lake site consists of 12 communities. Meadow Lake, which is a small city of about 5,000 people, and the project includes 11 surrounding communities. 5 of them are First Nation communities. One is a Métis community. Overall, the population is about 12,000 people, and then the rural municipalities as well. The community had already identified that there was concern across sectors about the high number of youth coming into the ER with suicide attempts. And the Roots of Hope became available during that time. There was real interest in having an evidence-based project, where we could be guided by best practice and have the benefit of outside knowledge on how to do suicide prevention work. The biggest impact of having the Roots of Hope working in Meadow Lake and area has been awareness and also the relationship building. Without the relationship building, nothing happens. You have to build trust and engage people. We really tried to get an upstream fix on what could work to influence youth, not just, immediate risk of suicide, but the kinds of things that get youth to the point where they start to lose hope. It's especially male youth who are among the youth population the most likely to die by suicide. And so we really focused on what are those influences? What is it about young men that they don't reach out for help in time? Those sorts of things. And we also looked at what might be upstream, maybe of the stigma. So which groups could we influence or work with to influence how people think about suicide and how they respond to suicide? There's still a fair bit of fear out there about even saying the word, that you might plant the idea in someone's mind. We know that that's not true, but that takes education and stuff to get the general population and even partners to be aware that talking about it is the best thing, not the worst thing. The best way to start would be to engage your community to find out what their priorities are. Sometimes what I found is that where people think they want to work in terms of suicide prevention isn't always where we think we should start. And if you want to engage people, their priorities have to be on the table. A couple of communities identified their priority as working on parent-child attachment and relationships between schools and the parents so that they can support their kids and so that there's good communication between the schools and the families. That's an example of letting them identify their priorities. It's easier to engage people in the advisory committee and that sort of thing if people really feel like you're going to listen to what they've got to say.
Commission de la santé mentale du Canada, Mental Health Commission of Canada. Commission santé mentale.ca